If you look back in the 1920s, 1930s, or even into the 1950s, polio had been and continued to be then a serious problem. Poliomyelitis was the reason why a lot of different children hospitals were built in the United States, mostly for convalescent, for their rehabilitation.
One of the things that was done was called the Sister Kenny method. Sister Kenny was a nurse. She believed in hot packs to kids with polio in their extremities to help them be able to move more.
My name is Annalee McGee, and I'm a polio survivor, and I am 89 years old. I was admitted to Raleigh Hospital in 1944. Of course, right away I was started with treatments, and they provided a lot of things for us to do. They also had the Sister Kenny hot pack treatments. So we would have 6 and 7 of those, and they were really hot. Those were on almost an hour before they would take them off. And then in between times, we would have school. And we would have needlework. They also had the exercises. And it was hard. Those exercises were not easy. Polio was painful. I thought, I'm never going to walk again. But God had another plan.
I'm Chandy John, Ryan White Professor of Pediatrics at the Indiana University School of Medicine. We have therapies we didn't have before. In 1938, there were essentially no antibiotics, and there were very few vaccines. And so a lot of infectious disease was saying, you have this, can't do much about it. Summers used to be very scary for children. Summer is when poliovirus typically spreads. People got to pools. They'd get infected with polio. Most of them would do fine, but a not small portion would get paralysis from it. Franklin Roosevelt, our president, had paralytic polio. That's why he was in a wheelchair. And so people understood the importance of polio vaccination and the incredible change that happened when that vaccine came and people could now go out in the summer and be okay if they were vaccinated. It was just transformative.
And then people start realizing that, we don't need hospitals just to care for poliomyelitis. However, we have all these other conditions that children need to be cared for and evaluated and treated. And that's basically what you've seen in hospitals, including Riley Hospital for Children, has sort of evolved into that.
Our first pediatric infectious disease doctor was Marty Kleiman. Marty came here in '76. And he was an incredible clinician and teacher. He didn't leave any stone unturned when trying to come up with a diagnosis. And one of his most famous patients, of course, was Ryan White. Ryan was a young boy and had AIDS, HIV, from transfusions he received because of his hemophilia. Most people were skeptical of the diagnosis.
And when he went to school, the parents and the students didn't want to be around him because there was so much fear around AIDS. At that time, it was mainly homosexuals and drug addicts that acquired HIV/AIDS. And he was the first person to put a face on this and change people's attitudes towards HIV/AIDS and its treatment. There didn't need to be the kind of fear and bias that people had.
It turned the tide, really, when people started saying, okay, what can we learn? I shouldn't be afraid. This kid looks just like my kid or looks just like my neighbor. And it really started to be the first step to opening people's eyes and their minds and their hearts towards what being HIV positive meant, which was a huge step forward. Not to mention, it started the Ryan White Care Act in his honor in DC, which has helped thousands upon thousands of people get access to medication and to care. And look what that's done, because now we see HIV as a chronic disease, not a uniformly fatal disease. And that all really started from the words of one little boy and his lion-hearted doctor who just continued to do their work in advocating. So then years later, Indiana University Dance Marathon was started really in honor of him by his high school friends. They've raised over $50 million for this hospital. It paved the way for us to work with the legislature here to ensure that all pregnant women have access to HIV testing and prophylaxis so that we can stop mom-to-baby transmission. And I think, the other thing about the whole HIV/AIDS and what we learned, I felt it again during COVID. And there was so much fear and there was so much rumor that just those themes kept coming back.
Indiana hitting a marker no one wanted to see. The Hoosier State tracking the highest infection rate in the country.
Today, the state health department confirmed more than 5,400 new cases and 124 additional deaths. More than 6,000 Hoosiers have died.
COVID-19 was hard to ignore. Everybody was potentially vulnerable. That worldwide scope and the fact that it could affect everyone was a real wake-up call to everybody. And no one in medicine has seen anything like COVID-19 during their career. It was perceived as not a problem in children, but those of us who were taking care of kids in the hospital, we saw that it was a problem. Kids were coming in, they were coming into the ICU, a small number were dying. So we decided to do a couple of studies to look at transmission of COVID-19 in the community, to look at development of immunity in children. The Department of Pediatrics funded those studies, and we were able to show how antibody immunity developed in children with COVID-19, and also the presence of COVID-19 in the community in children versus adults. And I think those studies helped with sort of outline an understanding of what was happening in children. During the peak of the pandemic, COVID was in the top 10 causes of death for children. Deaths occur very rarely in children. And so if you have something that causes deaths in children, that's a very bad thing because it's a far less common phenomenon than in adults. Without the vaccine, it's been estimated that we'd have had 19 million more deaths if we didn't have that vaccine. So it was absolutely a miracle. But the work isn't over. There are many other infections other than COVID-19 that we need to prevent spread of. I'm on the American Academy of Pediatrics Committee on Infectious Diseases, and we write a book on infectious diseases. It's sort of the Bible of infectious diseases in children. How do you identify them? How do you treat them? How do you prevent them? And this was the original book written in 1938, and this is the book that was written in up to 2024. There's a new edition coming out. And the reason for the difference in size, you can see a very big difference, is because the combination of vaccines to prevent diseases and then antibiotics to treat them if you get them has been this incredible revolution in medicine. And what it means is that children survive. I mean, children died from those diseases, so now they actually can make it to adulthood. And it's just an incredible transformation. And that's why those of us in infectious diseases are so pro-vaccine, because we are pro-children, and we're pro-antibiotics, but we have to use them responsibly. And that's really important because for many infections, we now have organisms that are resistant to antibiotics, and that's a direct result of overuse of antibiotics. We're one of only 13 children's hospitals that's an international center of excellence in antimicrobial stewardship, and so I'm very proud of that and proud of the work they do because they're gonna keep antibiotics useful for kids.
That is one of the beauties of coming to a hospital like this. You know, it has a strong affiliation with the Indiana University, with the School of Medicine, and other universities within the state. So that brings more innovation in and more collaborations. And who's the people who benefit from that are the children. And obviously their families, right? Because they get their child back to where they want them to be, healthy, right?
So for the last 100 years, Riley's been a leader in pediatric care and advocacy in the state of Indiana. In the last 40 or 50 years, I think advocacy in particular for infectious disease has taken off. And the last 10 years, we've really become a research leader nationally and internationally in infectious diseases. And in the next 100, I think we're just going to expand that. So we'll be a global leader in pediatric care and research and advocacy worldwide.